ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਤੇ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਜੀ ਆਇਆਂ ਨੂੰ। ਮੇਰਾ ਨਾਮ ਹੈ ਹਰਲੀਨ ਚੌਹਾਨ ਤੇ ਤੁਸੀਂ ਮੈਨੂੰ ਪਹਿਲਾਂ ਦੇਖਿਆ ਹੋ ਸਕਦਾ ਹੈ, ਪਰ ਅੱਜ ਮੈਂ ਤੁਹਾਡੀ ਮੇਜ਼ਬਾਨ ਹੋਵਾਂਗੀ। ਅੱਜ ਦਾ ਸਾਡਾ ਪ੍ਰੋਗਰਾਮ ਹੈਗਾ ਤੁਹਾਡਾ ਸਿਹਤਮੰਦ ਬੁਢਾਪਾ ਤੇ ਉਸ ਬਾਰੇ
and we'll talk about that. So, before going forward, we would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, and Tsleil-Waututh peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of these lands. As I told you, I'm your host, Harleen Chauhan. I'm a pharmacist. And let me tell you about digital medication. What does it iCON mean? It means intercultural. We are associated with the University of Digital Emergency Medicine. What is our purpose? To assist multicultural and indigenous citizens, patients, and caregivers, and the community at large about chronic diseases, to help them. And if you're living with somebody who does have chronic diseases, we can help you with that, how to take care of them. We also want to tell you, in the age of internet today, that what you're reading there in news or on YouTube, that all that information, how you should look at it, does it belong to you or not, and you should trust it or not, and what things you should not trust. And last of, we want to tell you that about our healthcare providers, the people who provide you healthcare, and yourself, how to have a good communication between them and how to improve it. And that's example today. And we are here, your caretakers are your speakers today, and you can ask them questions. We will start today with our opening remarks.
Thank you for the opportunity to provide opening remarks at today's Strengthening Health and Wellness as We Age forum. I'm Lindsay Arscott, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health, and I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with this land continue to this day. The Ministry of Health's Patients as Partners initiative believes that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but it is an effective way to make the health system better and the people of BC healthier. This philosophy is summarized by our motto, "Nothing about me without me." Patients as Partners has collaborated with and funded iCON for about 15 years with Dr. Kendall Ho as the executive director for all of this time. iCON continues to bring healthcare providers together to speak with people in their first languages about topics they want to learn more about. And today, that is about how we can stay resilient and as healthy as possible as we age. As we age, the risk of being frail increases. However, getting older and frailty are not the same thing. By taking a holistic approach to health, you can stay healthier longer. For example, Cardiac BC states that about 90% of premature heart disease can be prevented with good health practices. Additionally, a recent study by the U.S. Centers for Disease Control and Prevention found that the evidence demonstrates that the strategy of self-management and educating ourselves achieves desired outcomes in multiple chronic disease contexts, including diseases of the cardiovascular system, diabetes, asthma, and arthritis. So there's lots that we can do. I want to thank iCON for bringing us together today, and I invite you to check out the resources after this discussion. You will find information on self-management, eating well, staying active, building resilience, and many other topics. There are websites where you can enroll in self-management, health coaching, and other peer support programs that provide information, skills, and support to help you achieve your health goals. Some of these resources and programs are provided in different languages to make them more accessible. Also remember that encouragement and support from working together as a family and in the community can make it easier to make these health changes. I want to express a big thank you to iCON and our presenters. I appreciate your time. I want to thank everyone for attending. What you do for your health can make a big difference. Thank you. Have a great session.
This was from the Ministry of Health, a couple things. The things that she said that I want to bring into your attention that my health is in my hands. Otherwise, there is no health. So what you can do with your health and to decide to make judgments about your health. Next speaker, Dr. Leena Jain. She couldn't make it here, but she sent her presentation so that you can listen to it, all of you. Dr. Leena Jain, she grew up in Chandigarh, so Bachelor of Medicine and Bachelor of Surgery, Heart and Medical College, Delhi, and after that, Doctorate of Ophthalmology, meaning she becomes specialist of Rajendra Hospital, Patiala. Then they shift to America, and then she did another degree in medicine, internal medicine from Chicago, and then after internal medicine degree after that, then geriatrics, meaning aging people, aging patients, that fellowship, University of Chicago. Now Dr. Jain, it's been 20 years, last 20 years, she's internal medication specialist and geriatrician, and she's working with Fraser Health. Dr. Jain has a Royal College of Physicians and Surgeons. She has a fellowship from there, and she also has fellowship from American College of Surgeons. So they are very much educated, the speakers we brought today. So now Dr. Jain will give us information about aging and dementia, and she will talk from home. So now you will be thinking about what dementia is. If we simplify it, is the information. This is the disease of forgetfulness. Sometimes the patient says, while we are old, we forget. We sometimes in our community says they have lost it. Like after 60, there are problem with the memory, with brain. But this is not a right thing to say. But normal aging, the changes that come to the brain with aging, those are is a slower learning of new information. So with the new information, with phones, with the technology, and to learn all these things, it's a slower processing speed to learn all this, computer, TV, technology. But the things you have learned, forgetting about family members' names, where you place things, and you forget about. This is not normal. The problem when these memory problem affects. This is not normal aging. That's not a change with normal aging. If these are the things, these are symptoms. If they are progressing with time, this is not normal. What is dementia? Dementia is a brain disease. It doesn't only affect memory, but also affects decision making, judgment, behavior, personality, and it also affects day-to-day function ability. It impacts that as well. This disease has 3 stages. There are 3 stages: mild, moderate, and severe. Means when a person is normal, you can see in the picture on the left side, this person is able to do everything in mild stage, some brain functions decline. So gradually making decisions. So then in modesty is then it starts declining in memory, personality, and day-to-day activities, and at severe stage, then that person becomes completely on his or her family for everything. As Dr. So he told you, the frailty, there are so many reasons to become frail. Dementia is also a risk factor for frailty for some, for especially for those people who are diabetic and other health problems, and if they also have dementia, is the big risk factor for frailty. So it's very much important to get information about that.
Why do we need information regarding dementia? Because dementia is gradually increasing. In Canada at this moment, approximately about 771,000 people are living with, and out of that, 85,000 are living in BC, and 30% of those are from Asian communities. That's Indian, Pakistani, and East Asian, all of those included. And it's estimated that by 2031, that number is expected to rise to almost 1 million in Canada, which is 66% more than 2020 census. So it's rapidly increasing. And we should have knowledge about it. How to manage it, we need to know that, and what to do about it. Many patients who come to me, they ask me what's the difference between dementia and Alzheimer. And I explain to them that dementia is a color or multicolored. There's so many colors in it. There's a red, green, yellow, and there are many types of dementia. If you look at an over 65-year-old Alzheimer dementia, there's one type of dementia that's vascular, stroke type, where somebody has that they have these kind of problems. That's also dementia. And there are many dementias that with the Parkinson, they have Lewy body dementia that some runs in the family. It starts in a family. That's called frontotemporal. And there's some deficiency of B12. It can affect with that. Or some due to injury, some to excessive drinking, there are changes. So there are many kind of dementias. And most common is Alzheimer out of that. I'm showing you a slide. I wish to show it to you because you can see on the left there's a brain. That's a normal person's brain, which is bigger. And the grooves in there, they're smaller. If you look on right side, the brain has shrunk, and that's a brain with Alzheimer's patient. In there, the brain material has changed, and the shape has changed. If we look at a normal versus Alzheimer patient, if you look at slides, what's happening in the brain actually, on the left on the screen, that's a normal brain. There's no deposits in there. The cells that are in purple, those are brain cells, and the function is normal. On the right-hand side, on the slide, there's cells that has neurofibril type material in there. that's deposited in there, and their protein deposit between the cells, where cells are not unable to activate each other, and they don't get the message, and that leads to dementia. What are the risk factors for dementia, and how can we save ourselves? There are some risk factors we cannot do anything about it. People over 65-year-old, it happens to them with age. It's going to increase. We cannot change that. And some dementia are with the family history. We can't change that. But there are certain things that we can change. One is blood pressure. If we control the blood pressure, the dementia risk can be decreased. People who have diabetes, if they control it, and that can also help with the risk. And and if you are fat, especially in our community, if you have bigger stomach, and that's also a risk factor for dementia, we should control it. And there's another risk factor, and we ignore it quite a bit. Hearing loss. So hearing, once you getting weaker, that's also a risk factor. People don't want to put a hearing aid. They think it's bothersome. If you don't hear well, it's also a risk factor for dementia. You should take care of it. What are other risk factors for dementia? One is alcohol. Drinking alcohol is very dangerous, and it's a risk factor for dementia. Smoking as well, and it affects your brain, and you can have memory loss due to that, and multiple injuries to the head, and that can also change, and depression as well, isolation, and that's also a risk factor. And mental and physical inactivity is also a risk factor for dementia. What can we do about it? As I told you about the risk factor, to control it, as I told you, and take control of your health in your hands. You should be able to control your diabetes, your blood pressure, and follow it strictly. Second one, keep your brain active, healthy. You should play such games like cards or puzzles or memory games, and that will also help. Yeah, you can, do word search, puzzles, and people who are retired, they think they spend so much time watching TV, just sitting. Keep your brain active. Try to learn new language, a new musical instrument, or do some volunteer work. Music and painting also helps, saving you from dementia. And when people start forgetting things, and they don't want to talk to people, and if that happens, to do brain exercise, it's very important that you socialize with people, don't live alone, keep seeing your relatives, your family, people you know, keep your brain active, and stay happy.
What else we can do? We can do yoga, we can do meditation. This is very good in our community, that this is a good thing that we believe in these things. So then these things will take towards positivity. They are reduce the stress, take care of your health, see your doctor regularly, both for checkups and specific health concerns. Now, you will be thinking, how would you know that you are having dementia? Yeah, even in the early stages, there are signs. Repetitive conversations, like you will speak a sentence, then you speak that sentence again, and then you will ask the same and same questions again. So, repetition. And then, so forgetting recent conversations. For example, if somebody called, a phone call, or somebody visited, you will forgetting those right away. Misplacing items, and you will forget. You will place things, and then you will forget. This is normal. Little bit of these things are normal, but more than normal things, leave your purse somewhere, leaving your jacket somewhere, forget taking for medications, and then making mistakes in recipes while cooking. So if you put you forget if you put sugar or salt, if you did or you didn't. Yeah, and then leaving the stove on, and as I mentioned earlier, you are making mistakes taking medications because you can forget taking one, and also when you are driving, you just forget about the way and you go somewhere else, and for difficulty performing familiar tasks, like whatever the task you are familiar with, when you are having difficulties now, when the dementia is starting early stage, you have problem with banking, uh, maintaining bills, paying bills, you face difficulties. And beside that, there are changes in the mood and the behavior, changes in the thinking, changes in the judgment and decision making. One important thing I want to mention here, people who have dementia in the beginning, they get to know that there is something wrong, and then when people around them, their family, they laugh at them, and how come you forget, then the self esteem get affected, and they go into depression. Once they are in depression, and then over dementia, then is a more problem. So people should think about that. So just maintain your inner strength, and family members also should get some education about that. I just told you the main symptoms right now. If you are feeling all these symptoms, if you are thinking you are getting this symptom, please talk to your family doctor. Let them know these are my symptoms, so that they can talk about your proper history. They can do checkups. There are things that could be corrected. For example, vitamin B12 deficiency of B12, depression. So, uh, like like you think it's dementia, but there are some deficiencies, so that the doctors can correct it, so that the problem could be corrected. So it's better to go as soon as possible to your doctor. Once you are diagnosed with dementia, what should you do after the diagnosis? First of all, you should you shouldn't be thinking that there is something wrong or stigmatized about it. We are with very ease we can say that there is a stone in our kidney, there is a problem with the liver, there is other physical problems, but we try to hide the mental problems. It's not your fault. It's just a disease like other diseases. Don't feel stigmatized. Don't hide it. So you should tell people around you that I have this problem, so that they don't laugh at you, and so that you don't feel ashamed. And secondly, in our community, there is a Alzheimer's Society of BC. It's a very good resource to support. It's a South Asian for Punjabis. And there is a number. If you contact them, and all the family should see them. They will support you. They will give you information. They will give you education to the whole family. So they will give you some exercise. They will give you information all about other community resources about Alzheimer and dementia. And then you can talk to your family doctor if they can start medication for the memory that can stabilize the memory. When you go attend doctor's appointment, what you should do, take your family member along who lives with you and is able to tell the family doctor day-to-day changes. So whatever changes they notice day-to-day, they can. Secondly, take all your medications, including over-the-counter, other herbal medication, anything, all the medication, take it with you to show to your doctor so that the doctor can check if they are appropriate for you or not. Third thing, as I told you earlier, don't hide your symptoms. There is no need. It's not your fault. Sooner you treat it, so your life will be better. What you will expect at doctor's appointment? And the doctor will assess your memory and do some test, whatever they think is appropriate. So so that they can whatever is so that they can decrease the speed of dementia. So the progression of dementia, that can they can give you medication that can stabilize dementia or slow down the progression of dementia. They can give you that kind of medications. There are other resources. They can connect you with those resources like Alzheimer's Society of BC, First Link, Handyride, taxi services. They can connect you with all those things, especially for those people who forget their way due to dementia and they can drive. So there is a lot of sources and they can connect you with those resources. It's very important, critical for dementia to be diagnosed early because there is no medication that can cure or reverse symptoms of dementia. So there is no cure. There is no cure that can end dementia. So the research is going on with a lot of force, but there is no cure so far. The medications we have, if we start in early stage, that will stop the progression and also stabilize the symptoms of dementia. So for that, your life, with those medications, your life will be much better. So if you start medication in the severe stage, then it won't be that helpful. So sooner the better to have a good quality of life for years to come. So I want to let you know about some resources in the community. If you have any health related, if you have questions, if you need help, you need support, you can call 811. People who don't speak English, they have they can have the services in Panjabi. There is a then you can say Panjabi when you call 811. Then someone who speaks Punjabi, they will provide with a translator or Punjabi interpreter, and they will connect you all the resources in Punjabi. This is very important that you have this support available. So it's very important for you to reach if you want. Okay, we start questions. First one is about bones and joints, is for Dr. Sohi. Two questions. If your bones start growing, what you should do? The second is, if in your joints or in muscles, if there is stress or breakdown, what are the regions and what can we do for that? First of all, we talk about the bone. When the bones are weak, frail, we can see with the test. It's called bone density test. When you do density test, if the bone is weak, there is a level. First level, we call it osteopenia. So where we live, there is not enough sunshine. There is a vitamin D deficiency in the community. Where if there is a deficiency calcium, vitamin deficiency, vitamin D deficiency. So the first step is you you should increase calcium and vitamin D to protect your bone. So if they are more really frail, when you reach to the stage of osteoporosis, that means in the bones you can think about they are rotten, they are very frail. Then for that you have to take tablets and other medications that can help the maintain the bone or regenerate the bone. And so you should, if they are going down, bone density test, talk to your doctor. So he will, if you are on the first stage, if they are really weak, vitamin D and calcium is needed. You need a prescription for that, and we can help you with that. Whatever can you do to protect bones? Exercise. That means which exercise? Yeah, so the one that can stress your bone. Walking is good for your heart, for your breathing, but it doesn't do anything to your bones. So the exercise that were shown, and they will show after in the afternoon for your bigger muscles. If you put some load on those big muscles and bones, so that's how you can address the frailty of bones. The second question about the joints. As you age, the joints, our joints, it's arthritis is common problem in our joints when we age. It's called osteoarthritis. When it starts, for that arthritis, we can't do much with that. But the joint and the muscles related to that joint, up and down, for example, your knee or your shoulder with arthritis, you have to make your muscles strong, like your shoulder muscle, your arm muscle. You can decrease the pain you can lower the pain. You will not need that much medication for that. You can apply creams that lower the inflammation. You can lower the pain with the creams or exercises. Sometimes when the pain is severe in the joint, then we have to replace the joint with the surgery. So in the early stages of that pain, we can refer you earlier. When the pain is severe, then you make a referral. Then waiting list is long. The surgery takes 2-3 years. Then the frailty kick in because you are not using that joint. So you are not walking that much because the knees hurt or your muscles are weak. Then, so what can we do with the muscles? You ask this question. Exercise, as I told you earlier, and protein in your diet. So these two are the main important things. If you are 70 kilos, if you are 90 kilograms, so the minimum you need is the 70-gram protein in a day if you are 90 kilo. So more protein you take, it will help your muscles. When you exercise, your muscles get a good stress, and with that they are strong, and with the age they decrease, and we can stop it from progressing. Next question is, unnecessary bone growth is the same mechanism like arthritis. When your joints, when there is a breakdown of calcium and calcium deposit in your bone, whatever space there should be is called grease too, is fluid in the joints. When that fluid is nice and smooth, and then the joints are spinning nicely, but when that extra deposit is there, then they are not that smooth, and then it doesn't spin or move nicely smoothly. So to stabilize the joint, those bones, you cannot remove it until there is a surgery, and the muscles around it, you can make them strong and you can stabilize the joint. So the issues in the joints is usually gradually increase over the years. In the beginning, you are exercising, stabilizing the muscles, that will strengthen your joints. Your question, you want to ask more? Lunchtime, Gurmeet Soi will be around. You can ask her that time. Any personal question you are asking, remember, she's not your healthcare provider. So, so they have a license. Everybody has a professional license. She has a license. You can ask general questions. Don't ask liability questions. So especially some of the things we can't answer, we don't have your history. Please remember that. Your family care provider can tell you most of it because they have the history. We don't. We are not your healthcare providers. Please ask questions, but general questions. There are line of questions. You write your questions. You can write your questions. Please write. There is a line.
1200 milligram calcium in a day that you can take. Some people take calcium pills. It's fine if you're not getting it as part of your diet, but that can create constipation. But otherwise, you can take 1200 milligram calcium vitamin supplements. If you're not aged, but you're still not getting a lot of sunshine, you can take 1000 unit of vitamin D. If you have a kidney disease or knee disease, that your calcium intake is different. If you have kidney disease, it can be different. You can ask your doctor about that. Next question is about social work. You're representative of social work. Both questions are same type. They want to ask, if somebody's in your home, they need a placement, they need a care home, and you can't look after them, how to do it. Can you help with that? If you can help, how to contact social worker. There's some information that was provided in the package as well. Bone Health Service line, you can call them in the Fraser Health if you are in the Fraser Health area, and they'll do an assessment, and they'll look at that if your family member is suitable for a nursing home or available for home sport, if that facility is available or sources. And usually they start with that. And if that is not helpful, Then they look at a facility if you qualify for that or not. But it's also that worth looking at if your family member is, if they want to go into a facility or not. Because if their memory is still good and they don't want to go, you can't really force them to go there. As my mom's condition was, she would never go to a nursing home, even in her last days when she knew in hospital that my health is not well, that perhaps I have to go to nursing home because it will be really hard at home. And then she just lost her courage. Even then, we tried to convince my mom that we are not able to care for you and you get tired as well and there are so many responsibilities, but she didn't want to go to a nursing home. Then we couldn't force them. But if mental ability and your memory is losing and the doctor is saying that this person cannot make her own or his decisions, and you are unable to care for them, then they can decide which care home is better for them. You can talk to your doctor or home health care. Next question is for me. And people who are here on super visa, can they see their pharmacist or prescription? And let me tell you what super visa there's a clause in your super visa insurance if you know somebody, and read that clause. If you have a BC Care card, and even in a super visa, if you have a BC Care card, those resources are available to you, which are available to BC residents. If you go to see a doctor, there's a fee available that you have to pay. If you need to ask questions from your pharmacist, and if about the medical review, if that's covered or not, perhaps it's not covered if you're not a BC resident. It depends on your care card, and it depends on your MSP. Right. Next question. It's the same. Again for Dr. Sohi. Dr. Leena Jain is not here. Dr. Sohi will help us. 2 questions. First of all, if you can tell again, dementia and Alzheimer, what's the difference? And if you spend more time on the phone, and can you get dementia? First question, if you think dementia is a general category, and dementia has many types, Alzheimer is a type of dementia. If you have Alzheimer, that means you have dementia. And some people might have dementia, but it's not Alzheimer type. It's different. Dr. Jain explained that. If you have stroke and your diabetes, sugar, and blood pressure problems, it affects your brain differently. And it can decrease your thinking or cognitive abilities, vascular, and if you're Parkinson, you can have dementia due to that. There are different types of dementia. Alzheimer is usually short memory, what happened today, yesterday. You start noticing that earlier. And when you see geriatrician, you ask them many questions about thinking, about your family, what they saw, and then you do memory tests, and then you can figure out what kind of dementia you have, Alzheimer or any different kind of dementia. Some people have it mixed. In our community especially, have diabetes problem, heart, stroke. And some people, Alzheimer, vascular, they get the same that dementia at the same time. And when we see you, we can diagnose that and what to do next. And next question, that's a very important question, that our phones, TV, when you look at it, when you're sitting, you're not actively using your brain. YouTube, WhatsApp, videos you're watching, as you're aging, I'm not saying that it can lead to dementia for you, but it's a risk factor. Because you know two things. There are two things that can decrease dementia risk: hearing and medical issues. One is exercise. If you do exercise and your brain cells are fine, they remain strong. Other is socializing. People who spend too much time on the phone and they don't pay attention to new interest, and that starts the weakness of the brain. It starts faster. If I can say, exercise is really important, and to learn new things. And if you socialize, see other people, you talk to them, you learn something, and you use that brain in that setting, there's no comparison to that. So use the phone the least amount of time, watch TV the least amount, go for a walk, exercise, spend time with friends, family, kids, and spend more time with them. It's beneficial. Next question. We have only a few questions. I know we have lunch coming up, so we can eat. Next question is pharmacist. I can answer that quickly. Question is how you can arrange a meeting with pharmacist. The pharmacy that you go to, you can book an appointment with the pharmacist there. You can talk to them about your medication. And the pharmacy that you usually go to, where you get most of your medications, you can make an appointment there. And I'll be here at lunchtime. You can ask me personally. And if you have allergy with the changing seasons, antihistamine or allergy medication, can you take? Can you take it all the time or as needed? You can do it both. If you have allergies all the time, you can take those allergies medication. But which medication you should take, you should ask your pharmacist. Some medications that can increase your blood pressure, your sugar level, make you sleepy. Which antihistamine you should take, you can ask them what conditions you have and what's the best for you. And if it doesn't help, there are prescription medication available as well. You can get it from your doctor. Yes, you can take it, but just be careful about interaction. Next question, the last question is for Sir. What is Taxi Saver and how you can get it? Especially here in Lower Mainland and in other areas, the service might be different. Taxi Saver program it's through Translate. You have to register. It's called Handy Dart. There's so many coupons available that you can get a taxi at 50% off. There's Handy Dart, that's buses. Then you go to the appointments and they're available for you in the community services. And if you want to go socialize to go make an appointment, and there are tickets available. Taxi Saver program, you can get the coupons from Translate, but you have to register with Handy Dart, and you can use it for 50% rebate at the taxi fare. And Handy Dart has many criteria as well, where you can't use the public system, or you can't walk or sit, or you cannot use the normal public system, and you need that service. It's not available to everybody. And I'll just give a couple more suggestions. Secondly, if we have serious illness and we cannot look after ourselves or the person we are looking after, you are unable to do that, there are many financial benefits available through there's a disability tax credit, and you can get an application through your doctor if you have illness like that. And I just want to give you a suggestion at the end. And right from the beginning, we have so many stressors in life. And now the counseling services are available. And like moving forward, there's a organization available. They give you free counseling or for lower pay. And there are many other services available in the community. I'll encourage you. And, we also need counseling. Sometime in the family, there are so many stressors in life, in our family. And to look after our health and to seek help is also important. Thank you.